Good morning and thanks for joining us on our program, TVC Breakfast. My name is Etoma Edu.
Well, a very good morning, Nigeria, live from our studios right here in Echo Atlantic. We're here to make sure that you start your morning on a very perfect note. You know what they say, once you start your morning right, your day will be perfect. There is a lot to talk about on the show this morning. I am Ria Abdul and of course, welcome to our show.
Well, you heard them, Nigeria. Indeed, it is time for breakfast. Now, you could be anywhere, but you're choosing to spend your morning here with us on the TVC Breakfast Show. We're very grateful, and you're very welcome. I'm Olamide Ojekunle.
Absolutely. It's the midweek edition of TVC Breakfast, and we're here to give you all the information you deserve to know. I'm Ibrahim Shita, and good to have you join us.
Good to have each and every one of you.
Somebody should say welcome to me now.
Etoma.
Nice to see you. So handsome.
He looks.
Oh, thanks.
You know, immediately he walked into the set. What was the first thing I told you?
Oh, you look good in pink. I say pink.
So good.
He didn't take the compliment. He was like, yeah, thank you. You should have been more.
That's Etoma for you.
What do you want me to
Yeah,
do?
thanks.
Dance a jig?
Well, good morning, gentlemen and lady. Like I said, there's a lot to talk about on the show. But before we even begin, our Muslim brothers and sisters, they've started fast. So we're wishing them the very best. May Allah grant all their prayers. And to Ibrahim as well.
Amen.
You know, I mean, may God grant all your answer all your prayers.
And I will say, Taqabbal Allah minni wa minkum. Meaning, may Allah accept it from me and from you.
Mashallah.
Amen.
He has changed already. This morning he's been like an angel. Mashallah.
All right, well, a very good morning to you, Nigeria. You know how we do it. Let me give you a rundown of what we'll be talking about on the show this morning. At some point, Ibrahim will bring us all the headlines that have made it to the newspaper. We get to dissect it right here on the show. Just after that, we'll be talking about something very, very important. We'll take you all the way to the National Assembly, where we'll be talking about the Electoral Act. That's a very important conversation. We'll definitely bring it to you. And then later on, we will speak about women's participation in politics. A very, very solid conversation we'll be having. And then Olamide will bring us everything that's been trending in the world of social media and more. So please grab that cup of coffee and let's have a very fantastic show. Now we'll start with the story. Ask yourself, what if every Nigerian child had the skill to save a life before professional help arrives? This may become possible in the nearest future as the federal government is making moves to integrate emergency health education into primary and secondary school curricula nationwide. Now, the discussion follows a conference organized by the Health Emergency Initiative in collaboration with the Nigerian Educational Research and Development Council. According to officials, the initiative aims to foster a culture of preparedness among young Nigerians by equipping students with essential life-saving skills, including first aid and CPR. You know, just reading that story, I want to put my hands together. This is why am I the only one clapping? You don't think it's a fantastic initiative?
It is indeed.
This is a very fantastic initiative, and I'll tell you why. Because I schooled in Ghana, and I remember in school that time, something had happened to, I will never forget this, something had happened to one of our colleagues, and it was all of us that gathered together just to check. She had fainted, actually. We don't know if she was pretending, but she fainted. And we just gathered together, you know, because we knew what to do. So in Ghana, it's something that is taught. You know how to handle like all this first aid equipment and all of that. It's beautiful to see that in Nigeria, we're now trying to, incorporate that. Imagine a young person being able to save a life just before, maybe the ambulance and the emergency team arrives.
Yes, when I was in primary school, we had things like that happening. It may not have been in the curricula, but the school, they had some kind of collaboration with the Ministry of Health, where from time to time they come give us health tips, they come give us first aid tips and things like that. And you will notice that when things like that get ingrained in a child's mind, they take it home and they teach their parents, even without knowing that they are teaching their parents, they teach their parents. It is a fantastic initiative. It is one of those initiatives that when I hear about, I sort of feel like now we are talking.
Yeah.
Now it is happening. And they shouldn't stop at just health education.
Yeah.
There are several other things. One that I'm really passionate about is Nigerian history. Nigerian history should be taught in primary school. So maybe they should start putting a conference together that will now decide that, look, it's about time elementary schools in Nigeria start knowing about Nigerian history. That fosters patriotism in the child.
Etoma, fantastic. You've put it so beautifully, because I remember the other time somebody was talking about Nigerian children not even knowing the history of Nigeria. So that's something we definitely need to look to. But let me come to you, Olamide. I don't know how your days were in secondary school, but oftentimes we know that somebody will faint, somebody will get up, there may be an emergency that will just happen. It's beautiful to see that we're bringing now these kind of reforms, because oftentimes we've said our educational system, what are we really doing? What are we teaching these children? But I think this is a very, very important thing. Like Etoma said, if they learn, they take it home. If they learn, they teach their friends. And just imagine a child being able to save a life.
Absolutely. It's high time we rejig our curriculum to give students real life skills that can, like the article said, this headline, strengthen national resilience. Countries that have emergency training initiatives like this, like parts of Europe and Asia, they've actually shown that they have higher bystander survival rates during things like cardiac arrest or accidents. They actually people have better chances of survival when children, people around them are equipped. And not only that, it's important that we note that this sort of initiative could lower healthcare costs in the near future. If people get injured, they're less likely to have more severe injuries that would lead them to either go to the hospital to seek out healthcare. Everybody understands first aid. And it's very important that we equip our children in this way, because we've seen many incidents that require that if somebody was standing by and had first aid, that require first aid knowledge. So it's a very, very welcome initiative.
Yeah. And as they teach our children, Ibrahim, they also need to teach some adults, because oftentimes you see an emergency and the first thing people take is their phone to start videoing. When you're supposed to just treat that person, but they video because they don't know the right thing to do. But now we're seeing it start with our kids, and they say when you teach a kid something, a kid's memory is they take a picture, and then that picture lives with them for the rest of their lives. But I hope this is not just something that we're mentioning and we do not follow through, because when we give news like this that is very beautiful, we hope that they will sustain it. Let them not start 1 month, 2 months, and the next thing we don't hear about it again. I'm really hoping that it even becomes a subject that will be exam, on.
Certainly. There used to be integrated science. So these were some of the things that we were taught growing up in school. But when the time goes by, the curriculum changes, and you tend to imagine exactly what has been happening in some of those schools. You actually took it right out of my mouth when you said, when accidents happens, people, the first thing they take is their phones and they start taking pictures because everyone wants to create content. So you can't even draw the lines between what content is the right content for me to make, versus someone's life, which I need to save, in an emergency. So it is very, very good, and this is going to help. And when you teach children, as you all have said, it's going to be ingrained in them, it's going to be imbibed by them, and then they are ready. So it's going to foster the culture of preparedness, that if anything happens, you know what to do. And it's so good that, the mortality rate in the country is going to add to it, because when you say women live certain number of years, I think 50-something, for men, I think it's even lower than that of the female folks. So that is going to increase the mortality, reduce the mortality rate in Nigeria, contribute to it, meaningfully, positively. And that's one. And the other thing is that it's going to help with legal confidence, in the sense that if you want to help someone, you wouldn't be afraid of, if I touch this person that is dying, if I touch this person that is, that needs help, won't they say, I contributed into the person's death? But because you have knowledge, because you have the skills, because we're all people there, they know the right thing to do, they know how to, give CPR, then you would be willing to do such. You understand? And I think they should also speak to hospitals, doctors, and all of that. They've been saying that, but we need to imbibe that culture of, when there is an emergency, doctors should stop asking for police reports, because it goes a very long way.
Quickly,
very quickly. I remember in secondary school, talking about our experiences. I remember frying puff-puff in home economics class. And I never in my life has anybody ever said, please quickly fry this emergency puff-puff. It's not a skill that should have been imbibed in me. I wish this was around.
No.
When I was
so maybe you never
puff-puff.
can tell, because if you get married to someone who likes puff-puff,
oh my God. Gentlemen and ladies, we have to go now. But the most important thing we'll say is that it's not just starting it. Let's make sure that it can stand the test of time. Sustainability is actually always key. We'll take a breather now, and when we come back, Ibrahim is ready to give us all those headlines that have made it to the newspaper. Don't go anywhere. This is TVC.